We have your GHRP peptides, like Ipamorelin and Tezemorelin. You have our GHRH peptides, like CJC-1295 and Tezemorelin. BPC 157, which we talked about orally, also comes in injectable form, and TB500 as well as GHK-Cu. All of these are going to be discussed as to how they're used injectable. So we're going to dive into what each of these does and what they are and how to dose, and more importantly, side effects. So GHRH stands for growth hormone releasing hormone. These are two examples, CJC-1295, sometimes just called CJC, and Tezemorelin. And they stimulate our anterior pituitary gland, they stimulate our pituitary gland to naturally produce more growth hormone. So it's not giving you more growth hormone. So if we gave you growth hormone, first of all, it's illegal in the United States. It's only indicated for growth hormone deficiency, but over time, it's going to downregulate the receptors, your growth hormone receptors. No bueno. You want to give stuff that's going to naturally increase it. It enhances recovery, accelerates tissue repair, decreases recovery time between training sessions. So remember I said some people can't recover very well. So this is where it may come into play. Helps with body composition. Most people report feeling leaned out. Tezemorelin really targets the belly fat. We'll talk more about that. It enhances sleep. And as a side benefit, after a month, many people note that their libido has increased. What's not to love about this? However, we're going to look at the side effects, so you do want to know what they are and use them judiciously, depending on what the patient has underlying. So we wouldn't just use these alone. You would use them in combination with GHRP. So growth hormone releasing hormone causes the release from the pituitary, and then we'll dive into what are GHRPs. Growth hormone releasing peptide also stimulates the pituitary gland to release natural growth hormone. So one will stimulate the secretion and one stimulates the release. It has very similar benefits: the sleep enhancement, the performance benefits, the recovery, the leaning out. And then in this case, the Ipamorelin and Tezemorelin promote skin elasticity, bone density. So many women are coming in osteopenic, if not osteoporotic, at younger and younger ages. Supports cognitive function. And it's really all through maintaining growth hormone. So as growth hormone goes down with age, just like the rest of our hormones, all of our sex hormones, our adrenal, our thyroid, etc. So usually they're used in combination. Usually do not use growth hormone releasing hormone alone, or the growth hormone releasing peptide alone. Sometimes Tzemorelin's been used. The CJC-1295 was taken off the market, so it was used as a single agent for a while. Now it's back on the market. And so they're used synergistically. And again, it's to trigger this pulsatile release from the anterior pituitary. And then for all the reasons, so growth hormone affects obviously muscle development, loss of visceral fat, and that's more pronounced in the Tezemorelin. And it stimulates our liver to produce IGF-1, and that's insulin-like growth factor 1, and that is what allows us to build that muscle mass. And I should say this is all without direct gonadal stimulation. So it's really not going to impact the rest of the sex hormones per se, but it's going to help support growth hormone production. What's the dosing? Typically, CJC-IPA is how we call or refer it in our world. So CJC-IPA, instead of saying the whole name, is dosed 5 to 6 nights out of the week. Usually you're pulse dosing it, 3 months on, 1 month off, and it's 10 units. And the amount that's found in this 10 units is about 100 micrograms of the CJC-1295 and 250 micrograms of the Ipamorelin. We've already talked about some of the wonderful benefits, so I won't reiterate those. Now, what are the side effects? Anytime you inject, you can get a mild site reaction, mild water retention. So the water retention, typically I'm dosing it at bed. You can give a dose in the morning fasted, and you can give a mid-morning dose. If someone is sympathetic dominant, that means they're in fight or flight, you're going to cause that water retention very quickly. So I won't tell you how I know this, but the water retention and site reactions usually resolve. You can get carpal tunnel like symptoms, but that's less common. Some may say they get an increased appetite. I have not seen that in my patients. Maybe slight insulin resistant, but at higher doses. And again, I've not seen these less common ones. The rare concerns with this are urticaria or anaphylaxis. So I had a patient that went from just a welt at the site to more welts throughout her body, and I really thought it was the injectable format. And I'd actually even prescribed nasal spray. And then I was at a conference, and this is why we should always be learning, always growing, always modifying our protocols. And I learned about this anaphylaxis, and I literally messaged her immediately in that conference. I said, don't fill the nasal spray. And if you've gotten it, the practice will reimburse you, because I did not want her to suffer anaphylaxis. That's life-threatening, right? So you don't want to ever do any harm. Now, the theoretical long-term risk, because it stimulates IGF-1 and stimulates growth hormones, or growth hormone grows things. If you have a pre-existing tumor, it's going to make that tumor grow. So you cannot use it in anyone who has active cancer. So my breast cancer patient, we would not use it in, the one that is actively being treated. And if someone finds out they have cancer, you want to discontinue it. Some docs are doing pre-nuvo scans, but I just recently learned about a blood test. Again, always learning. I had the privilege at a conference of introducing the founder of Cancer Check Labs. His name is Sumit Rai. That's inconsequential. He's so passionate about curing cancer or detecting it earlier because his sister died. He's invested millions into the company, spent 15 years, and they're now able to detect circulating tumor cells. So before it's a full-blown cancer, catching it at stage 0. So what would that mean if you caught a pancreatic cancer at stage 0 versus 4? And that could be a life or death sentence. There's a lot of cancers caught at almost any stage. We get good cure rates. Breast cancer is one. Prostate cancers tend to be slow growing depending on the type. But for pancreatic, it could be a big deal. So that would be something to consider, and I've thought about, but more importantly, you want to consent your patient. This is a possibility. It's in my consent form. So I don't prescribe even the oral peptides without the consent on file. And now more and more patients are coming for this. My staff has them read the forms, and they're signed before I even see them. And then I counsel them again on each peptide. And we choose peptides very carefully. Tezemorelin, as I'd said, it targets that visceral fat, but what you need to know is it's got one FDA approval. Patients are going to ask, and you want to be very transparent. That's that third value in our clinic. High service, high integrity, complete transparency. It's approved for HIV-associated lipodystrophy. So that's a redistribution of fat. And I've had colleagues show me their before and after, and pretty good results. So kind of gives you that 6-pack. Now, not in everyone. You have to be exercising and eating appropriately, but might be something to consider in adding to GLP-1s if someone still complains of that belly fat. And that's what I've indicated here. So it's off-label use. Again, it's off-label, not approved for this, is for that visceral fat. Dosing on that is 1 milligram a day. Same thing, 5 to 6 days on, cycle 3 months on, 1 month off. And it's to prevent that theoretic risk. Now, it shouldn't downregulate the receptors, but just so you don't build kind of a tolerance to it, so to speak. Now, for recovery and healing, and I'm excited to share some cases later, are the following: BPC 157 and TB 500. You can use them individually or stacked. And when they're stacked, they're known in the biohacking world as the Wolverine stack, just so you're aware. I should mention that all the studies on BPC are currently in animals. So there's very limited human data. I really am crossing my fingers this will change, because I've seen such an impact within my practice. And when I report any of these results on the internet, if I'm sharing cases, I say my patients report. I never say it leads to XYZ. That's like making false claims. The last thing you want to do is have the Federal Trade Commission breathing down your throat saying, hey, you're making unfalsified claims. You can say, it supports my patient in healing. It has supported my patient with gastric peptic ulcer disease and get him off his PPIs. So dosing is similar. Orally, it's 500 micrograms twice a day. This is given 500 to 1,000 once a day. Some practitioners advocate taking that 1,000 and dividing it. In my mind, who's going to be more compliant? The patient who uses it once a day or 3 times a day? I really haven't found a difference. So it helps with tissue healing and regeneration. It's great for tendon and ligament recovery. It's anti-inflammatory. And if someone's on a limited budget, just use the BPC 157 for healing. It is on the WADA ban list for competitive athletes. Why would they put it on the WADA ban list? Because it improves performance and healing, so that recovery after exercise. The TB 500, that one is dosed 3.57 milligrams. This one's only twice weekly. Just know the concentration will vary. So I'm not giving you the units because it depends on how the compounding pharmacy you're using compounds it. It causes actin remodeling, enhanced cellular movement to the injury site, great for post-op healing, and it actually enhances and complements that BPC 157. Here are the clinical applications where I've used it clinically. I've used it in dozens of cases for post-op recovery. Always start 1 week pre-op and then continue for 2 to 4 weeks post-op. Usually a vial is about 2 weeks for each of these, and the expense is going to be an issue. But if you can get 2 weeks, and I'll share some cases. Injury recovery, if someone has a soft tissue injury or a ligament injury, performance recovery. I had one young gentleman come in with a pilonidal cyst, acutely flared. He's having surgeons tell him they want to remove it, marsupialize the lesion. He'd be have to pack a dressing on his bum for a month, and a 20-year-old who's going to do that, right? So we ended up treating him only for 2 weeks with just BPC 157 alone, dried that right up. Now, what it doesn't do is that is an anatomic open tract, and he has been able to keep it from getting reinfected and had never went on to surgery. So in my opinion, that's a win to prevent a surgical case in someone who's young. So key takeaways, you've got your delivery methods: oral, injectable, nasal, sublingual, topical. The key oral peptides we reviewed, and this is by no means all of them: BPC 157, KPV, PEA, lorazepatide, TB4, and the PeptiStrong. You've got your injectable peptides, the GHRHs and GHRPs, the different recovery stacks, which coupled in copper peptide and the KPV, mitochondrial peptides, and the thymosin alpha-1 for injection. And how do we apply these? You're going to use them for health span and longevity, chronic disease management, recovery and regeneration, as well as immune support. So remember, the dosing protocols are going to vary. There's not a standardized protocol. You definitely want to make sure that you're adhering to any FTC, FDA, state regulatory guidelines, and of course, monitor for effects, counsel. Don't use them if they're contraindicated, and source them from a reputable pharmacy that's sterile and also does third-party testing.
Thanks for listening to Solving the Puzzle with Dr. Datis Karazian. Start your 7-day free trial at KarazianInstitute.com if you're a licensed healthcare practitioner ready to evolve your functional medicine practice. Explore over 300 hours of clinical training, masterclasses with leading functional medicine clinicians, and certification pathways. Or check out the Academy of Functional Nutrition and Lifestyle Medicine at afnlm.com. Whether you're on the path to certification as a functional nutritionist or simply want to optimize your own and your family's health, our skill-building approach builds real-world competence from the ground up. And lastly, if you're dealing with chronic health challenges, visit drknews.com for self-paced courses that help you understand and address fatigue, brain fog, autoimmune conditions, gut problems, and more using evidence-based approaches. The content on this podcast is for educational purposes only and is not intended to diagnose, treat, cure, or prevent any disease. Always consult with your healthcare provider before making any changes to your health regimen. Thanks for listening, and don't forget to subscribe and share with someone who might benefit.